The vaccine maker says its updated COVID shot provides protection against the new BA.2.86 variant. Moderna says it has shared its data with regulators. It's ready to distribute the vaccine once officials give it the green light. FDA approval is expected sometime before a September 12th meeting of vaccine advisors for the CDC, so it's in the pipeline. Joining us to talk more about it, public health physician and regent at large for the American College of Preventive Medicine, Dr. Pernell. Nice to see you. So is this vaccine a good thing if approved? What's the significance?
Yes, it's a good thing, Marni, because we need to ensure that the greatest amount of the public has gold standard protection. And gold standard protection means that you have the greatest amount of neutralizing antibodies in your body, so your immune system is as muscular or robust as it can be to protect against the prevailing strains or variants. And so now that we know that these latest strains, whether it was XBB or when we saw EA5 or now we say BA.2.86, that the current boosters that will be made available, not available yet, but will be made available, will provide adequate protection.
All right. There is a type of flesh-eating bacteria that's on the rise. This is scary stuff. It has officials with the CDC at this point sounding the alarm. It's called Vibrio vulnificus, and doctors are seeing an increase in a number of states along the East Coast. There have been 6 deaths from this infection in Connecticut, New York, North Carolina. Normally, some deaths each year we see in the Gulf states, but it's rare for it to be spiking on the East Coast. What is this, and what's the biggest concern here?
So, Marni, Vibrio actually has several different species. The one that you mentioned is the one that we know can cause the watery diarrhea and can cause the ulcers and skin infection, and in worst case scenarios, sepsis and the flesh-eating bacteria that causes the skin to just peel away and be destroyed. What is of concern is that it's appearing in the Northeast. We don't normally see it in the Northeast, and that the main important thing for folks to know is if you have an open wound, if that's from a sore, if that's from an injury, if that's from a recent tattoo or a piercing, you should not get in coastal waters. Also, be very, very concerned around raw or undercooked shellfish, in particular oysters. We're advising people to stay away from those things. If you develop any symptoms, any GI symptoms, so nausea, vomiting, watery diarrhea, or any skin wounds or infections, you should report to a doctor.
And I mean, death, obviously the worst, but we've heard of amputations as a result of some of this. What's the treatment if somebody catches this infection?
So early detection is very important. If you don't have early detection, persons can unfortunately succumb to the infection, though that is rare. 1 in 5 persons who have the infection with the Vibrio vulnificus actually die. But we do have antibiotics that are effective at treating the infection. So it is important that providers as well as the public has a more vigilant awareness around what could potentially be happening and what they're at risk for.
Mitch McConnell, he's been in the headlines for those 2 freezes recently. Republican Senator Rand Paul says he believes the Capitol physician's assessment of the Senate Minority Leader's condition is misinformation. It's clearly not accurate, his words. The Capitol physician said he didn't think McConnell had a stroke, didn't think he had a seizure or an episode related to those. Instead, he thinks it may be due to dehydration. He's 81 years old. We saw those 2 times that he froze on camera in the last couple months. The doctor says there's also no evidence he has a movement disorder like Parkinson's disease. Medically speaking, what tests would they be running to determine it? Because it seems more than dehydration without my doctor's degree.
Definitely, Marni. So what we had been seeing in the public is that the senator had altered mental status, right? For a moment or two, he was not able to respond to questions. He appeared to be frozen. Now, in order to rule out Parkinson's, you want to do a thorough neurological exam that includes asking the person questions as well as doing things with a physical exam. If we're looking at whether or not there was a stroke, you want to do some type of imaging of the brain. Our standard tools to image the brain are CAT scans of the head as well as MRI that can also show whether there's been death of neurons involved. The doctor is saying that neither of those two things, which would be the most alarming, are actually being implicated. And finally, we would be concerned for whether or not he was having seizures. If a person has seizure-like behavior or activity, you can do an EEG. Point being made, the EEG may not actually identify the epileptic focus, but it is a tool that we use to help better understand and answer what's going on. We should be concerned because whenever a person has altered mental status, we want to make sure it's something that's not going to lead to disability or even worse, death.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.